Hi, my name is Adrienne Young, and I'm a fourth year PhD candidate in the School of Social Work. So my dissertation research is looking at youth engagement in youth mental health systems. And so I think many people might realize or have heard that there's this youth mental health crisis in Canada. Like less than 20% of youth are able to access appropriate mental health treatment. And that group of youth includes mostly age 16 to 29. And I put the crisis in parentheses because there's sort of always been this focus or attention paid to the well-being of young people. But in this day, something that is quite popular among different mental health institutions to meet that need better or to better or to improve youth mental health services for young people is through different ways of engaging young people with lived experience with mental health concerns into program planning, program decision making, evaluation. And a popular tool to do that is a youth advisory group or youth advisory council, youth advisory board. And so as I increasingly saw those popping up across the mental health systems, I was curious, what kind of impact those are actually having and what the process of that is like for youth, especially youth who are historically marginalized by the mental health system. So youth that the mental health system was really not designed for, such as racialized youth, Indigenous youth, queer youth, low-income newcomer youth, who are often the target of these advisory groups. So my elevator pitch is that my research examines the process and impact of youth advisory groups in the mental health system. I have been working with youth for a really long time and enjoy being around young people. I always have. And I have been a part of planning and facilitating and evaluating a couple youth advisory groups across sectors and one in mental health before returning to do my PhD. And I just found that they were often so limited in what the young people were able to do, or the goals and ideas that the young people had were not being met by the institutions, or there were just a lot of bureaucratic barriers to having the impact that young people wanted to have. And so I felt like pursuing more research into this area could maybe help improve these systems for young people. And that's really the first reason. And the second reason is that a lot of these advisory groups use development models or kind of engagement models that are drawn from Western systems. And as an Indigenous person and Indigenous scholar, I've had the opportunity to learn so much more about the way that Indigenous groups approach young people and the way that young people are valued as a part of the governance in society in Indigenous groups across Turtle Island for time immemorial. And so I felt like there was this kind of unique opportunity to bring in an Indigenous lens and how young people are valued and the opportunities young people are given with the way that the mental health system is doing that, and to use this two-eyed seeing lens to evaluate advisory groups. My favorite part about the research is talking to young people and visiting these groups where young people are so activated and engaged in improving the mental health system for others based on their own experience and wanting other young people to just have access to mental health care that feels appropriate and personal and less sterile and medical. And I think young people have such excellent ideas to do that, that's a really special part of the research, is to be able to interact with those groups. So right now I've just passed my proposal and I'm working on my ethics application. But while I have been doing that for the last few years of my PhD, I've also been working as a research assistant at YouthRex, which is an organization out of the School of Social Work that works with youth programs and young people about increasing youth engagement and youth representation across sectors. So I've got to be involved in a lot of different projects, meeting with youth programs from across the city, and helping them with evaluation and meeting the young people that they work with. And I also am a research assistant at the Center for Indigenous Knowledges and Languages, where I work on a climate project and specialize in evaluating and understanding how youth are engaged in climate leadership at the UN and at national levels and at home. So it's been a great opportunity to still be able to explore my topic and look at it from a lot of different angles before I jump into doing my own research and data collection, which I hope to start in the new year. My research, I hope, will shed light on youth experiences of these kind of advisory groups and help mental health practitioners and policymakers and leaders across the mental health system to understand why youth want to be involved in advising the mental health system and the real value that young people bring to these systems. And as a social worker, I think we often talk about how important it is to hear from folks with lived experience, to follow the idea of nothing about us without us. That was popularized by the disability rights movement in the 1960s. And so for me, it's really obvious that you would include young people in mental health system and value their input as lived expertise. And so I hope that this research kind of continues to showcase that. And in that same vein, I think using a two-eyed seeing lens to be able to bring in that Indigenous knowledge about the ways that youth can contribute and should contribute to their communities. I hope to showcase how all of these Western ways that we're talking about it are represented in Indigenous knowledge systems, and that incorporating those Indigenous knowledge systems can be beneficial for all youth, not just Indigenous youth.